therapeutic prenatal techniques that I like to do, just to give y'all some more options. One of the number one complaints I hear from prenatal clients is that their therapist was afraid to touch them. They're not fragile. They can be. You don't want to do a super deep tissue massage, obviously, but there are some good trigger points and stuff like that. So let's get started. As was nice, I put some a hot towel on her back because, I know some people think that you can't put heat on prenatal, which isn't true. You don't want to put it throughout their whole body at once because that can cause a lot of inflammation. And as I get started, I wanted to ask you guys, if you don't mind, please subscribe to this channel. Hit the red icon below. You'll see some other neat tricks and tips on other stretching. First thing we're going to do is warm up. So she's in one of the, I can't say her name, so her name is anonymous. So how far along are you now? 21 weeks. Okay. We have this nice prenatal pillow that allows you to lay on your stomach. I do recommend it because it does I've had a lot of clients feel like they're floating in a way. And it's the first time they can lay on their stomach in a long time. One thing I like to do is a lot of trigger point work. Just make sure if you're doing trigger point work that you wash out the muscle really good after. That way it doesn't get, cause any swelling or discomfort later. And also different clients have different tolerances. Like if she's been getting massages a lot, even before pregnancy, her body's used to it. So she might be able to handle a little bit more. But if never had a massage, well, probably wouldn't start out too deep on her. I usually say if it's ever like over, because on a normal client would be maybe over a 7, I don't, if they can't breathe through it and stuff. This one specifically, I don't want anything over a 5, in pain. But right now we're just warming up the muscle a little bit. We're going to jump right in though. So first thing I like to do is make sure you hit some shoulder blades. You can go on top of these shoulder blades right here. You'll find some trigger points. Remember, a lot of times through pregnancy, their front gets bigger, which means everything's going to pull forward more, so it's going to be pulling on these back muscles a lot. Well, that means this is going to be a little sore. What I like to do is put one hand over my thumb, and that way I can get a trigger point. And if I'm going too deep or anything like that, like I just saw her jerk a little bit, I might lighten up a little. She's not the one that usually likes too much pressure, but I do have some clients that, prenatal that, like a little bit more pressure. So I'd recommend, when you start doing this on a prenatal client, say, hey, the first time we'll go a little lighter to medium pressure, and we'll see how your body tolerates that. If it tolerates it pretty well, then we'll go ahead and get in a little deeper. Next time, build that treatment plan and that, work with the client. So now, a lot of therapists don't know how to actually get to the pectoral muscles and from face down. There's actually a good way. I know right now she's like, dang it, I thought I was going to stay face down, no pectoral work. But what you do is, if you want to come around here, Brittany, I'm going to borrow this arm. What I tend to like to do is do it in this position. I can slide under the shoulder into the pec major and do some work through there. And just kind of hit some of those points and kind of rotate our arm. A little passive release technique. Just to help release the shoulders. And then you can come on the other side and go under the pec minor. But remember, that one's a little bit more tender and you're not able to see this as much, but I'm using this part of my fingertips, not the pointy part, because, well, I don't want to make her mad. Just kind of get in there. And now this will, some light trigger point work, help release the front of her shoulders. That way, this stops pulling so hard on her. One thing I always stress to my therapists that work for me, definitely after if you do something that they don't usually like as much, make sure you do some nice stuff after. So I like to always include the neck. You can kind of run your fingers up through the neck. Now, some people may wonder, okay, can you use elbows on a prenatal? Well, I'm not going to just do this to her. I mean, that would, not make her very happy. But what you can do, as I'll show you, is kind of line your arm up against the spine, not on the spine, but just against it, and focus on their breathing. That way, they start taking some really deep breaths. It might be a little too much, but I'm keeping one thing that controls the amount of pressure your arm is how high my hand is. So if I'm way up here, I'm going a lot deeper. If I'm way up here, I'm a lot deeper than that, but I'm not going to do that to her. So just kind of guide my way through. Like I said, not deep tissue. The deep tissue would be if I was dragging the elbow through. Instead, I'm releasing, sliding, pressing, letting her breathe through it. And then releasing, slide, and when I slide, I don't go too deep. I'm going to be pretty controlled. Make sure you go all the way through the front. And then, a lot of your techniques that you normally do on other clients, you can still do on prenatal. You can do some light stretching on them. One I like to do is connect under elbows and just lean back. Nothing intense. And then you can remember, if you like this video, please hit like, comment below if you have any thoughts, suggestions. I love learning too, so I think us as therapists have to help each other. I use the tips of my knuckles right in here. I don't dig right straight down, but just kind of going across. And you can do a gentle pull, and we'll put her back. Now the next thing we'll hit on is, I'm going to hit on some lower back stuff. That's how I do my upper back stuff, but I want to show how I do my lower back, because a lot of chief complaints that prenatal gets is as the belly gets bigger, it starts pulling on the back a lot harder and stretching out the ligaments in through here. So we want to help release the tension in lower back and the glutes and all that. So now when they're further along, remember, judge it based on your client, but what I like to do is I don't like to push straight down towards the stomach. I want to push more down towards her glutes. And what I do to apply the right amount of pressure, I put my palm over my fingers and guide down. Don't be afraid to get near their spine, just push the tension away a little bit. Now, one way I find that really releases the tension through their hips and the SI joint. Is actually what I usually do for clients is definitely as a pregnancy happens, I like to pull their leg out for them, even though sometimes they'll try to help. But the further along they get, they may not be able to. So I'm gonna find her leg somewhere. Hang on. All right, we got a leg. All right, so what I do is I'll grab the inside of her knee and I'll slide out. Now she's very helpful, she's helping me out, but now what that does, when I can put weight down, straight down, it's gonna open the pelvis and release some of that pressure through the front. So, now in my typical prenatal massages, if the client is comfortable with it, I'll go under the sheet with glutes just for this being on YouTube and stuff. I'm not gonna do that on this one, but I'll show you kind of the areas I hit. What you can do is like I said, I'm not pushing straight down, I'm pushing out towards her hip, getting the don't be afraid to actually go on top of the sacrum and just kind of push the tension away from it. Because a lot of times they'll get a lot of swelling through here, which causes the nerves to kind of be on fire. Like she just said. She confirms. One thing, oblique and through the QL over here, make sure you get all that. If you feel you can't get enough pressure through with your hands, you can put, like I said, a lean. This is really good for also even if they're not pregnant, you can get even deeper with, usually we'll line my forearm across it, but for the sake of this video, I'm not going to do that today. But what I like to do, so this is a really important move because like I said, it does open their pelvis up and eases that tension on the lower back. Now, you gotta be careful though. Make sure you communicate good with your client. But what I like to do, because the bone's right here, I want to get my forearm blade, the ulnar blade, along that bone. So it can be a little tender. And what I'm doing, I'm not pressing straight down towards her stomach. I'm actually connecting right next to the bone and then pushing out toward the hip and actually towards the piriformis. She may even feel a little bit of a stretch in her groin, but
feels good.
It feels good.
Because I have that thing that pulls from here to here.
Yeah. This one usually, like I said, it's an amazing technique for glutes, hips, sciatic. A lot of pregnancy clients get a lot of sciatic issues. Remember, I'm doing trigger point, not deep tissue, so what I'll do is I'll usually find one of the trigger points. Different people do trigger point different. Some people will just hold it for 30 seconds. I don't like that method. I prefer just you kind of hit a point, release, and then push again, kind of holding it maybe 5 to 7 seconds, release, and then do the same thing. Kind of like you're pumping the blood. And then walk your way down. And one thing, ask your clients if they're okay with glute work. Now, and make sure you explain to them why, and definitely if they're pregnant, because this is all good stuff for them. And I'll also have a prenatal stretching video on here. You can check out, there's some techniques to also align the pubic bone. There's some good hip flexor stretches that are safe to do during prenatal, during pregnancy. And then I'm going to come over here on that side. Actually, you're going to do a whole circle around. Come on this side for me. So, what a lot of therapists I see miss is actually doing the front of the leg. So a lot of hip flexor, quad issues, I like to use my forearm kind of as like a windshield wiper. I'll start here and go across. When I get to the IT band, I'll lighten up and then I'll push down through the rest. And you'll see. And try to get all up in here too, if you can see where I'm at. A lot of massage schools, they seem to stop where the leg here, and they only do this part of the leg, and it's kind of annoying because the leg keeps going, and there's a lot of other therapeutic stuff that needs. Just make sure you're communicating good. I'm using a fist. I'm not really pressing too hard right now. I'm just doing a little bit of pressure. And then, like I said, I'll do a windshield wiper move. Yes, I'm patenting that term now. Not really. And going across. And I'll do it again. And then up here is a really good one. Might be a little tender. Also, if you guys want to follow us on Instagram, we're on there as well. Just look Natural Forces Massage. Get some of that tension out of there. And then I'll like to come under now. And remember, I'm not going to push forward towards her belly. I'm actually going to push kind of at a diagonal across this way. So I want to find that piriformis. Really communicate with them if they ever feel it in there. Any pressure or anything like that. Like I said, you're building a relationship with these people, and you want to make sure to, really make them comfortable to say things to you because you're doing more therapeutic, Okay. And we'll bring the leg back. And here's some more good techniques. If you want to come on this side, Brittany. Brittany's our camera lady. So I'll start working the hamstring some. Another area I find that some people don't do is work on the groin muscles. And there's a lot of good ways to do it, and a lot of people, if it's just a relaxation massage, sorry, my tongue got tied, but just a relaxation massage is one thing, but they're in pain. Usually as long as you communicate, they're pretty comfortable with what you do as long as you get them out of pain. So I've broken up a lot of just kind of warming it up. I like to push on top, one hand on the other. That way I can control the amount of pressure. Do a little hamstring release. You can use your fist and down. Good for knees too. And down. And remember, the leg doesn't stop here. You keep going all the way up here and down. And down. All the way through the glute. But what I was saying about the groin, good way to get to it. There's a few ways, and I'll show you both ways that I like. This is one way. You can sit on the inside of the table, right through here. Get some lotion on there. Like I said, it's all about communication. So whatever they're comfortable with. So I don't press with my elbow. I'm more blade right here. And I'm doing trigger point. Remember, I'm not doing deep tissue. I'm not dragging my forearm through her groin because I don't want to be kicked in the face right now. But I'm doing more trigger point. Not walking, but more of a slide to the next spot. And just communicate. You can kind of go to their comfort level and comfortability, how high they want, because the muscles keep going up and there's a lot of release that needs to be done. Same thing. The other way I really like to do the groin, and this video is not about the what not to do in prenatal, what's not safe, this is more for therapeutic techniques. So if I did want to do some calf and feet work, obviously, I would just kind of do a little bit of that. You can just do a decent stretch. And I would normally do some feet work, but for the sake of the length of this video, I want to get to the other important stuff, more important stuff. So the other way to get to the groin, I love this technique. It's really good for lower back. So what I'll do, and I can actually, I don't know if y'all be able to see the leg with the blanket on top, but you can do it with them covered. So here's her leg. What I like to come on this side. Now I'll sink down in between the legs and then up into it with my forearm. And again, down and up. Maybe pretty tender. And one more good one way up here. Usually, does that feel pretty tender? Or not too bad? She's out.
Me?
Oh, yeah, I don't think she's known. I was talking to her.
Yeah, I didn't. But I'm listening.
Okay. Was that a little tender in there?
Mm-mm.
No? Usually it can be tender, it can feel kind of good. But,
That's my angry side.
it's her angry side, so. Just kind of breaking that up a little bit. If you can't get a good view on that side, you can come on this side, but I don't know. Just like this, slide down, up, like that. All right, and then, let's see, we'll do one last thing I like to do for stretching. I'll just do a little bit right here, but as far as stretching goes, I prefer to do them on their side, but for the hip flexors. Now you can do a simple one, just fold it straight over, make sure they're not feeling it in their lower abdomen, not putting pressure on the stomach. Do you feel the stretch?
Mm-hmm.
Okay.
No pressure.
No pressure, see. Now you can up this, and the way to do that would be to come under, hold their leg like this, and then you would push, don't push this way towards their stomach, push down. Now, if you feel any pressure, you tell me. And we're just gonna go up a little bit, tell me when.
Okay.
Where do you feel that?
Up my leg.
Upper leg, okay, well, she's feeling in the right spot. Okay. Well, those are a few techniques that I hope y'all liked. If you did, please hit like, hit subscribe for more. Check out my other prenatal video. Leave comments, let me know what you think. If you have suggestions, anything like that, it'd be beneficial from my side too. I can learn as well. We're all in this together as therapists. Thank you so much for watching today, and I hope you have a great day.